Hi friends, welcome back to my YouTube channel. Today we will discuss about Norcet 9 prelims paper. Let's get start. Identify the given image. Answer: fundal pressure to help separate and deliver placenta. Identify the lesion in the image: small, firm, pink-red nodule at the urethral meatus, pain during sitting in vulva region. A. Bartholin cyst. B. Urethral carbuncle. C. Bartholin abscess. D. Vaginal polyp. Answer: Bartholin abscess. Identify the given image. A. Kawasaki disease. B. Measles. C. Pertussis. Answer: A. Kawasaki disease. Identify the given condition. A. Exstrophy of bladder. B. Omphalocele. C. Laceration. C. Abrasion. Answer: A. Exstrophy of bladder. Identify the type of chorionicity based on the image. A. Dichorionic monoamniotic pregnancy. B. Monochorionic diamniotic pregnancy. C. Monochorionic monoamniotic pregnancy. D. Dichorionic diamniotic pregnancy. Answer: Monochorionic monoamniotic pregnancy. Identify the on the image. A. Supraventricular tachycardia. B. Sinus tachycardia. C. Sinus bradycardia. D. Normal sinus. Answer: A. Supraventricular tachycardia. Which of the following diseases is prevented by Gardasil? A. Cervical cancer vaccine. B. Breast cancer. C. Lungs cancer. D. Liver cancer. Answer: A. Cervical cancer vaccine. A patient on a mechanical ventilator is receiving FiO2 100% in PEEP 42 cmH2O, and chest X-ray shows infiltrates in the lungs. What should be the priority nursing/medical management? A. Reduce PEEP pressure to prevent BAVIC. B. Increase tidal volume 10 ml per kg. Answer: Reduce PEEP pressure to prevent BAVIC. A patient admitted to the intensive care unit, ICU, develops delirium, confusion, and restlessness. What should be the nurse's priority intervention? A. Administer antipsychotic medication immediately. B. Ensure patient safety and prevent injury. C. Notify family to calm the patient. D. Increase fluid intake. Answer: B. Ensure patient safety and prevent injury. A child accidentally ingests kerosene. Which of the following statements is correct regarding management? F. Insert 32 Fr Orogaster's tube. B. Gastric lavage is contraindicated. C. Immediate induce vomiting. D. Activated charcoal should be administered. Answer: B. Gastric lavage is contraindicated. A newborn requires resuscitation because the heart rate is less than 60 per minute despite effective ventilation and chest compressions. What is the recommended intravenous for dose of adrenaline for this newborn? A. 0.1 ml ADR plus 0.9 ml NS. B. 0.1 to 0.3 mg/kg per dose of 1:1000 solution. C. 0.05 to 0.1 mg/kg per dose of 1:1000 solution. D. 0.5 to 1 mg/kg per dose of 1:10000 solution. Answer: A. 0.1 ml ADR plus 0.9 ml NS. Which of the following shapes is different from the others? A. Circle. B. Triangle. C. Rectangle. D. Square. Answer: A. Circle. Which of the following is that antonyms of transparent is? A. Opaque. B. Mirror. C. Clear. D. Clean. Answer: A. Opaque. Which of the following is a synonym of vindicate? A. Blame. B. Justify. C. Accuse. D. Condemn. Answer: B. Justify. Fill in the blank. He was absent was ill. A. Because. B. Through. C. Since. D. If. Answer: Because. The Sputnik first artificial satellite was launched in 1957 by which country? A. United States. B. United Kingdom. C. Soviet Union, USSR. D. India. Answer: C. Soviet Union, USSR. A mother WIT and a twin pregnancy is admitted. One fetus shows no heartbeat, the second shows bradycardia, the uterus is tender, and the mother has hypotension with weak pulse. What is the most likely diagnosis? A. Placenta previa. B. Uterine rupture. C. Abruptio placenta. D. Vasa previa. Answer: abruptio placenta. A nurse assesses a patient with dementia. Regardless of the question asked, the patient replies, "I want to go home." This speech pattern is best described as A. Echolalia. B. Perseveration. C. Confabulation. D. Flight of ideas. Answer: B. Perseveration. A nurse is caring for a baby undergoing a minor procedure under anesthesia. The baby is conscious, drowsy, and maintains airway reflexes. This type of anesthesia is called A. General anesthesia. B. Moderate anesthesia. C. Mild anesthesia. D. Local infiltration anesthesia. Answer: B. Moderate anesthesia. A client's ABG shows pH 7.55, PCO2 25 mm of mercury, HCO 22 milliequivalent/L. What is the acid-base disorder? A. Partially compensate metabolic alkalosis. B. Compensate etabolic acidosis. C. Uncompensated respiratory alkalosis. D. Compensated respiratory acidosis. Answer: C. Uncompensated respiratory alkalosis. Which key on the keyboard is commonly used to refresh a web page or window? A. F1. B. F5. C. F7. D. F8. Answer: B. F5. A patient has an MMSE score of 19. What does this indicate? A. Normal cognitive function. B. Mild cognitive impairment. C. Moderate cognitive impairment. D. Severe cognitive impairment. Answer: B. Mild cognitive impairment. During delivery, a newborn's anterior shoulder becomes impacted behind the maternal pubic symphysis, shoulder dystocia. What is the first maneuver that should be attempted? A. Suprapubic pressure. B. Macrobert's maneuver. C. Wood screw maneuver. D. Zavanelli maneuver. Answer: B. Macrobert's maneuver. A person walks 2 m north, then 3 m east, and then 3 m south. What is the distance of the person from the starting point? A. 0.2 m. B. 8 m. B. 0.3 m. D. A 4 m. Answer: C. 3 m. Who was the first female governor of India? A. Indira Gandhi. B. Sarojini Naidu. C. Pratibha Patil. D. Sucheta Kriplani. Answer: B. Sarojini Naidu. Which one is used the output device? A. Mouse. B. Keyboard. C. Printer. D. Scanner Q. Answer: C. Printer. A female having primary amenorrhea after investigation found that she has imperforate hymen is likely to have A. Menorrhagia. B. Metrorrhagia. C. Cryptomenorrhea. D. Hypermenorrhagia. Answer: cryptomenorrhea. Santiniketan School found in 1901 by Rabindranath Tagore is located in which state? A. West Bengal. B. Assam. C. Odisha. D. Jharkhand. Answer: West Bengal. The anaphylactic shock example of A. Distributive shock. B. Burn shock. C. Hemorrhagic shock. D. Surgical shock. Answer: distributive shock. A patient is receiving chemotherapy. Which parameter should the nurse monitor first due to the highest immediate risk? Lab values: hemoglobin, HB 8.4 G/DL, urea, 10 mg per dl. Specific gravity of urine, 1.008. Platelet count, 18x103/L. Options. A. Hemoglobin 8.4 g/di. B. Urea 10 mg per deciliter. C. Specific gravity of urine 1.008. D. A platelet count 18x103/L. Answer: D. Platelet count 18x103/L. Who is known as the Missile Man of India? A. Homi Bhabha. B. Vikram Sarabhai. C. APJ Abdul Kalam. D. Rakesh Sharma. Answer: C. APJ Abdul Kalam. Find the next number in the series 2, 4, 8, 16 dash. A. 18. B. 20. C. 24. D. 32. Answer: D. 32. Who built the Jama Masjid in Delhi, India? A. Akbar. B. Shah Jahan. C. Aurangzeb. D. Humayun. Answer: B. Shah Jahan. Where is the headquarters of UNESCO located? A. New York, USA. B. Geneva, Switzerland. C. Paris, France. D. London, United Kingdom. Answer: C. Paris, France. Which Indian state has the longest coastline? A. Odisha. B. Maharashtra. C. Gujarat. D. Andhra Pradesh. Answer: C. Gujarat. A point of burn came in emergency and have toxicity of inhalation of co-treatment will be A. 100% O2 with non-rebreather mask. B. Face mask. C. Oxygenation by cannula 2 to 3 at. D. Intubation airway. Answer: A. 100% O2 with non-rebreather mask. A point having hallucination, nasal irritation, and anxiety. Which substance he consumed? A. Heroin. B. Marijuana. C. Cocaine. D. LSD. Answer: C. Cocaine. The priority nursing assessment in the first 24 hours after admission of a client with thrombotic CVA? A. Pupil size and pupillary response. B. Cholesterol level. C. Echocardiogram. D. Bowel sounds. Answer: Pupil size and pupillary response. A nurse uses a too small blood pressure cuff on a patient's arm. How will the blood pressure reading be affected? A. Higher than normal. B. Lower than normal. C. Normal. D. Not affected. Answer: Higher than normal. How many drops of rotavaccine are given per dose under India's immunization program? A. 0.2 drops. B. 3 drops. C. 5 drops. D. 5 milliliters. Answer: 2.5 milliliters to 5 milliliters. What is the correct route of administration for the MAN2 test in tuberculosis screening? A. Intramuscular. B. Subcutaneous. C. Intradermal. D. Oral. Answer: C. Intradermal. Which of the following is a weekly contraceptive method? A. Mala N. B. Mala D. C. Saheli. D. Chaya. Answer: D. Chaya. Midday meal supplement diet provides following nutrients: A. 200 calories and 6 to 8 gm protein. B. 200 calories and 7 to 10 gm protein. C. 300 calories and 8 to 12 gm protein. D. 300 calories and 14 to 16 gm protein. Answer: C. 300 calories and 8 to 12 gm protein. Which of the following is a live attenuated vaccine? A. MMR. B. Influenzax. C. DPTX. D. Pneumococcal. Answer: A. MMR. Which of the following is the official national helpline for mental health and wellness in India? A. Telemanas. B. eSanjeevani. C. Evandravala Foundation Helpline. D. iCall, TISS. Answer: A. Telemanas. The most important observation after a tonsillectomy is A. Pain at the operative site. B. Difficulty in swallowing. C. Bleeding from the mouth or frequent swallowing. D. Low-grade fever. Answer: C. Bleeding from the mouth or frequent swallowing. A patient has been administered an injection of hydrocortisone, Hydrocort. Which of the following should the nurse assess as a potential side effect of this medication? A. Hypoglycemia. B. Bradycardia. C. Hyperglycemia. D. Excessive salivation. Answer: C. Hyperglycemia. Which of the following interventions can a nurse use to reassure a patient with schizophrenia who believes their food is poisonous? A. Allow the patient to consume packed food or food from unopened containers. A. Assure the patient that all food served in the hospital is safe to eat. C. Offer food in the patient's own container. D. Explain to the patient that it is a symptom of a disease. Answer: A. Allow the patient to consume packed food or food from unopened containers. A 27-year-old woman presented with secondary amenorrhea, FSH is high, karyotype is 45. X0. What is the most likely diagnosis? A. Turner syndrome. B. COS. C. Androgen insensitivity syndrome. D. Klinefelter syndrome. Answer: Turner syndrome. A newborn whose mother is positive for chlamydia trachomatis should be optimally treated with which of these to prevent ophthalmia? A. Oral erythromycin. B. Erythromycin 0.1% ointment. C. Tetracycline 0.5% ointment. D. Is silver nitrate 1% ointment. Answer: B. Erythromycin 0.1% ointment. A newborn whose mother is positive for chlamydia trachomatis should be optimally treated with which of these to prevent ophthalmia? A. Oral erythromycin. B. Erythromycin 0.1% ointment. C. Tetracycline 0.5% ointment. D. Is silver nitrate 1% ointment. Answer: B. Erythromycin 0.1% ointment. A state of sedation during a continuum for a mechanically ventilated child. Conscious sedation is another name for A. General anesthesia. B. Minimum sedation. C. Moderate sedation. D. Maximum sedation. Answer: C. Moderate sedation. When examining a patient who is paralyzed below the T4 level, the nurse expects to find A. Flaccidity of the upper extremities. B. A hyperreflexia of the upper extremities. C. Impaired diaphragmatic function requiring ventilator support. D. Independent use of the upper extremities with efficient cough. Answer: C. Impaired diaphragmatic function requiring ventilator support. During breech delivery, after the child's buttocks have delivered, the obstetrician sees the nape of the neck and applies downward traction while holding the baby's ankles with a finger placed between them to assist delivery of the head. This maneuver is called A. Lovesets maneuver. B. Burns-Marshall maneuver. C. Pinard's maneuver. Answer: Burns-Marshall maneuver. Single umbilical not associated with A. Bilateral renal agencies. B. Malformation of anus. C. Cardiac defect. D. Esophageal atresia. Answer: D. Esophageal atresia. Which of the following correctly differentiates between surveillance from research epidemiology? Answer: A. Surveillance monitors disease trends continuously for public health action, while research investigates specific hypotheses to generate new knowledge. The phrase "to break the ice" means A. To start quarrel. B. To spoil the plan. C. And make people feel more relax. D. To create conflict. Answer: C. And make people feel more relax. Who developed the Java programming language? A. Sun Microsystem. B. Windows. C. Microsoft. D. Orica. Answer: Sun Microsystem. A pregnant woman in labor has cervical dilation of 5 cm, effacement of 40%, and fetal station -1. What is the current stage of labor? A. Latent phase of first stage. B. Active phase of first stage. C. Second stage of labor. D. A third stage of labor. Answer: A. Active phase of first stage. Patient undergoing hemodialysis develops sudden hypotension during the session. What is the priority nursing/medical action? A. Leg elevation. B. Increase oral fluid intake. C. Administer dopamine. D. Continue dialysis without intervention. Answer: A. Leg elevation. 34-week pregnant woman presents with severe hypertension, proteinuria +3, and a seizure. What is the next priority management? Answer: Give magnesium sulfate and prepare for delivery, CS, immediately. Patient presents with fever, lower abdominal pain, foul-smelling vaginal discharge, and bleeding, septic abortion. What is the priority nursing/medical intervention? Answer: Start broad-spectrum 4 antibiotics in 4 fluids. Which patient have priority to red triage? A. Pinpoint pupils and bronchospasm. B. 80% buns with stable vital. C. Cardiac arrest with no pulse. Answer: Pinpoint pupils and bronchospasm. A patient admitted with COPD exacerbation is drowsy and showing signs of respiratory distress. What should be the priority nursing action? A. Intubate client immediately. B. Administer oxygen 5 liter per minute wire nasal prong. C. Administer oxygen 10 liter per minute wire nasal prong. D. Maintain SpO2 between 88 to 92%. Answer: D. Maintain SpO2 between 88 to 92%. Which of the following is a sign that a baby is getting enough? Breast milk? A. Crying all the time. B. Wetting at least 6 to 8 diapers/day. C. Sleeping more than 20 hours per day. D. Demanding frequent feeds every 10 minutes. Answer: B. Wetting at least 6 to 8 diapers/day. A patient who underwent CAB has chest tube drainage of 250 milliliters per hour for 3 consecutive hours. What is indicates? A. Cardiac tamponade. B. Hemorrhage. C. Pleural effusion. Answer: B. Hemorrhage. A patient on lithium therapy presents with vomiting and diarrhea. What is the priority nursing intervention? A. Continue lithium and monitor. B. Withhold lithium immediately. C. Inform psychiatrist. D. Schedule routine serum lithium check next week. Answer: B. Withhold lithium immediately. Nitroglycerin have to administer at rate of 15 micrograms per minute and the dose is diluted 50 milligrams in 500 milliliters DNS. What will be the rate of infusion? A. 0.9 ml/hour. B. 90 milliliters per hour. C. 103 milliliters per hour. D. 19 milliliters per hour. Answer: 9 milliliters per hour. What is the causative agent of glomerulonephritis? A. Autoimmune. B. Group of beta hemolytic streptococcus. C. Staphylococcus. D. Escherichia coli. Answer: B. Group of beta hemolytic streptococcus. After delivery, patient come to the emergency department for hemorrhage that occurred 2 weeks after an uncompleted delivery is known as secondary or late postpartum hemorrhage. What is the most common cause? R. At uterine anonymous. B. Subinvolution of the uterus. C. Retained products of placenta. D. Uterine atony. Answer: Please comment your answer. A patient receiving haloperidol reports inability to sit still and constant restlessness. Which of the following is the most likely cause? A. Tardive dyskinesia. B. Akathisia. C. Parkinsonism. D. Dystonia. Answer: B. Akathisia. Thank you for watching this video. I hope it was helpful. Please like, share, and subscribe for more videos.